morning, everyone. Today we will be talking about a movement in order to create societies which are focused on well being. So, World Health Day is celebrated on 7th April every year, and each year there is a different theme to it. This year, the theme that WHO has chosen is Our Planet, Our Health, which basically focuses on how to have clean air, water, and food for everyone, not only for humans, but also for animals and every other living species. If we talk about the pandemic, then we can say that it indeed has showed us the healing power of science. But it has also made us think about the impact of our actions on our environment. So basically, WHO this year fostered a movement in order to focus on the well-being of our planet as well as on the well-being of humans, but keeping a harmony and balance between environment and humans. So if we come to think about it, why did WHO choose this theme this year? Well, if you look at the facts, then about 90% of the air that we breathe is contaminated. The weather and the deforestation, as well as the natural disasters, are already causing a lot of damage to our environment. But the human activities like burning of fossil fuels, the smoke that is released from car engines, as well as other vehicles, is not only causing damage to our environment, but it is also causing damage for our future generations. So let's take plastic for example. Plastic, it is non-biodegradable and it cannot be completely degraded. It does turn into smaller particles which are called microplastics, and this microplastic is making way into our food because when this microplastic is ingested by the marine life, then it is toxic for them. But when we eat those marine organisms like fish, then it makes its way into us. So we're indirectly eating plastics. Now we're going to talk about NCDs. Why are we talking about NCDs? Well, let me tell you, because NCDs are the non-communicable diseases and they cannot be treated. There is no cure for them. There are multiple risk factors for them, and you have to live with them for the rest of our life. And as for communicable diseases, we do have vaccines, so we can prevent those diseases up to a certain point. But for NCDs, there are no vaccines. If we talk about the prevalence of NCDs in low and middle income countries, then it is devastating. 85% of premature deaths, which are only in low and middle income countries, are due to NCDs. NCDs are obviously caused by different risk factors like unhealthy lifestyles and not being physically active and having poor diet. But when this number of NCDs is present in diseases which are already underdeveloped and low resource, then they go into poverty. It causes a burden on their health systems, and hence they are not left with anything to deal with emergencies if they do occur, like natural disasters or infectious diseases. So how can we help? Well, we can invest on the non-communicable diseases. Annually, 71% of deaths are attributed to non-communicable diseases, and 85% of these deaths are premature, which are in the ages ranging from 30 years to 69 years, which are the reproductive, which are the developing, and the years where a person returns to the society. And when these people die at such an early age, they are not able to give back to the society, and hence the societies go in debt. In order to treat these NCDs, a lot of cost is put for the medicines as well as the costly treatment. And that is the major hurdle that we are facing right now. Now let's take into perspective the global scenario of NCDs. Well, globally, the total number of deaths which are associated with NCDs alone are 80%. And out of those 80% deaths, 44% deaths, which are more than half of all the NCD related deaths, are due to cardiovascular diseases alone. Then comes cancer, which have a mortality of about 9 million. Then respiratory diseases, killing 3.8 million people. Diabetes, affecting 1.6 million, and all the other remaining NCDs, which account for 8.2 million deaths. We know that we can control NCDs to a certain limit, to a greater extent, if we say, by focusing on the 4 main risk factors, which are modifiable risk factors and should be focused on and have been stressed by the World Health Organization, which are unhealthy eating, tobacco use, physical inactivity, and excessive alcohol. If we cut these down, we can bring the level of NCDs down to a greater percent. Now, let's talk about the holistic nature of health. When we talk about health, we don't always focus on one thing. We focus on what we call the determinants of health, on which our health is affected by. They can be different determinants like socio-economic factors, economic factors, or lifestyle, biological, environmental. It can be a variety of factors. But let's talk about, if we look at this picture, then we can see that there is a watchman. And let's talk about this watchman further. Consider that this watchman works at a place from 9 to 6 p.m., 9 a.m. to 6 p.m. And he works in a country where there is high level of air pollution. There are no or little to none green spaces, and there are no place to walk. The places are crowded. Then do you think that by reducing and focusing on the risk factors, by not smoking, let's say, this person can protect himself from developing chronic respiratory diseases? Well, the answer is no, because as I've told you earlier, his environment is already so toxic and so full of environmental contaminants that this person cannot save himself from developing respiratory diseases under these circumstances. Moving on. Now let's talk about the Universal Health Coverage, UHC. So basically, UHC is a political choice, and it is the responsibility of every country and national government to pursue it. This is the definition given by Dr. Tedros, which is the Director General of World Health Organization. It is very important to achieve UHC, but it requires a lot of effort on the health systems as well as on the financing mechanisms. Obviously, this cannot be accomplished if we do not have a well trained health workforce. Now, WHO's call for well being by UNC. What is it? Well, we know that humans contribute to environmental degradation by a multiple ways, as we have already discussed, by throwing plastics, by burning fossil fuels, by wasting water. So, addressing these problems is the number one thing that we have to do first, because in order to find a solution, we must know that we have a problem, right? Joining the dots. Now, everything is interconnected in this world. We live in the world which has become a global village. Nothing is that is not affected, or nothing that we do doesn't have an impact on the other person, because everything is interconnected. Whether it be climate changes, the weather events, the human-based activities, or anything, all of these are holistically affecting environment in a negative way. So WHO is basically calling everyone to focus on the planetary health as well as the human health. And it can only be done if we join our hands for the cause. So the question is, what can we do as an individual to save our planet and our health? Well, let's talk about the government. On the governmental level, we can prioritize decision making. We can make decisions which are appropriate to our local context and obviously on the availability of resources. We should stop the use of fossil fuels as much as we can, and we should use alternatives for energy consumption purposes, and we should tax the people who are polluting, for contributing in the pollution of our environment, focusing on carbon reduction as well as giving quality guidelines and training people in order to have that particular mindset. What can corporations do? Well, they can switch off the lights, they can save energy, they can stop the greenhouse gas emissions, and they can promote and support breastfeeding as well as ensuring that safe water is available for all. So, moving on, what can health facilities do? Well, they can support their healthcare workers, they can identify opportunities to save energy, and they can advocate for health. Then, if we talk about the municipal governments, then they should promote and protect biodiversity, and they should make new parks, and they should ensure that the households have appropriate level of income to support their families. They should ban or tax the unhealthy foods and beverages companies, and they should make and find new ways to have renewable energy sources. What can we do as an individual? Well, we can raise our voices. We can tell people, educate people that this is a global issue. We can inspire others. We can switch the lights when we're not in the room. We can go and waste less plastic, go to environmental friendly products, recyclable grocery bags, for example. We can buy fresh products, and we can join our hands for a better tomorrow. So thank you. That was it. I hope you guys liked it. Subscribe for more.